Or I guess I should change that. Good afternoon. This is Dr. McDaniel. It's a lovely day in here in New York City, and I am a board-certified obstetrician gynecologist coming at you from Manhattan, Midtown Manhattan, New York City, and I'm bringing to you all things health-related for women. Thank you for joining me here at GYN Corner. Let's see. Yesterday, I guess I was going a little bit cuckoo because I said it was September 5th, and today is September 5th. So yesterday was September 4th. I'll change that on the presentation. But today is September 5th, and let's see. I previously spoke about tea tree oil and the vagina, garlic and the vagina, apple cider vinegar and the vagina, and today I'm speaking about boric acid and the vagina. So this is a Facebook live stream. Please check out the YouTube channel. Everything is nicely delineated there. Like, subscribe, follow. You get a heads up on the presentations and when I'm presenting them. And if you are available, you have a commute or you work from home, you want to listen to a radio, podcast are today's radios, and we have a podcast also. It's GYN Corner. It's on Apple, iTunes, Google Podcast, Spotify, Anchor, and 4 or 5 other ones. I'll mention them tomorrow. I suppose I'll have to put them on the Facebook and the YouTube so that if you like to listen to the podcast, you can check those out. So let's see. Today I'm speaking about boric acid and the vagina. Boric acid is a crystalline acidic salt. It apparently comes from volcanic areas around the world, and it is an acid, so it's been used for over 100 years to help treat vaginal imbalances, overgrowth, and infections. Now, boric acid has a host of utilities. Since 1948, it's been used as a pesticide, so it kills cockroaches, silverfish, ants, so it can be used as a poison for insects and for a multitude of uses around the home. People use it to clean metallic instruments. You can use it to clean restrooms. It kills viruses and it kills fungi. Now, I have had patients over the years telling me that they have read or they wanted to use it for bacterial imbalances or infections. It is not usually very helpful as far as bacteria goes, but it is really good for molds and fungi, and it's been used predominantly to kill vaginal infections. So Candida albicans, a yeast infection of the vagina. It can also kill some of the resistant vaginal infections due to non-albicans species, so particularly Candida glabrata, and then Torrelepsis and parapsilosis are additional benefits. So if someone has recurrent yeast infections, or they don't feel like they're getting any relief from the over-the-counter vaginal insert preparations, or from the prescription, the pink pill, the 1-day prescription, they may have a resistant or a non-albicans type of yeast infection. So boric acid has been used over the years to treat those specific types of vaginal yeast infections. Now, I'll always preclude this information by saying if you have an infection, you don't really know what it is, you'll always want to go to the gynecologist, have it checked out, and confirm that it really is a yeast infection. And then obviously if you have similar symptoms, time can't afford you, or you don't want to go to the doctor to be evaluated and treated, or you don't want to take prescriptions, you want to do a home remedy, then boric acid is a good option. Now, you can get boric acid prepared already in vaginal suppositories from health food stores or drugstores or online. I always prefer doing it yourself because you know exactly what's in it, and it's simple, it's inexpensive. You can have a large quantity. You can do it one time and just use it as needed. Now, boric acid is a poison. You don't want to take it by mouth. It has to be as a vaginal insert. And then a precaution with boric acid is, because it is an acid, if you have a scratch, a wound, a sore, an ulcer in the vaginal area or on the vulva, on the lips, you want to be careful, because if the acid gets on that sore or rash or open wound, it will burn. So if you have a lot of itching, irritation, you have the classic cottage cheese vaginal discharge, everything looks like it's yeast, then what I recommend is to take a little bit of Vaseline, that's petroleum jelly, place that around the lips at the vaginal opening, because even if you don't have a sore or an obvious wound or scratch or open exposed skin, if you've been scratching a lot, you're going to have microscopic tears or exposed skin microscopically. So if you put the boric acid or I don't want to say hostile, but kind of a harsh agent like that, it will still burn. So if you put the Vaseline on, that will protect the vulva and the vaginal skin. So just everywhere on the outside, just a thin film, and at the vaginal opening. And then the boric acid, you can buy that at most of the health food stores, some of the drug stores. If they have a homeopathic aisle, they will often have boric acid. And then if you go to the health food store or online, sorry, one second. Excuse me, I could feel that coming. If you go online, you can buy the little vaginal capsules or containers, little suppositories to place that in the vagina. So the boric acid comes as a powder, and the usual recommended dosage is 600 milligrams. Some of the pre-made ones are 300 milligrams, so obviously you have to double up, because 3 times 2 is 6. So you place 2 of the pre-made, but if you do it yourself, you just get the powder, 600 milligrams, you place it in the capsule, level it off, and then you can produce a lot of those capsules. The recommended capsule is the 00 or the 00 size capsules. So if you get they're little gelatin capsules or ovules, you get the 00 or the 00 size capsule. That's going to give you the 600 milligrams, and you place it before you go to bed. So 1 capsule of 600 milligrams a night before you go to bed for ideally a minimum of 7 nights, ideally 14 nights if it's a treatment for a discharge, an itch, irritation, a discomfort. That's a classic yeast infection. Now, if you have repetitive or frequent yeast infections, or some women tell me they feel like they always get a little bit of a yeast infection before their menstrual cycle, then you can do the boric acid suppositories regularly. I would recommend doing them twice a week, every week if you can, for at least a 3 to 6 month block of time. That will help to chronically suppress the yeast propensity. If you always get them before the cycle, you could do it every week. To obviously, I always have to state the obvious, but it seems obvious to me. You don't want to do the suppository if you're on the menstrual cycle. It's not going to be very helpful if you're bleeding. So it'll be twice a week for the 3 weeks out of the month outside the cycle. And then if it really is just a couple of days before the cycle, you could just do it in preparation. If you know your cycle's due to come, just do it 1 or 2 nights before the cycles, before you usually get your symptoms. Most people who have premenstrual symptoms of yeast imbalance or overgrowth or infection, they'll tell me that they'll usually feel irritated or discomfort, or they'll see a discharge for the 3 to 4 days before their cycle. So if you notice that pattern, you could just do the suppository a couple of nights before you usually have the symptoms, and then for a few nights into when you usually have the symptoms. So if it's always 3 or 4 days before the cycle, you could do the suppository insert 3 to 4 days before you usually expect those symptoms, and that will usually ward it off so you're not uncomfortable. Now, some women will notice that they'll have a little bit of leakage or discharge the following morning. You just wear a shield or a liner in anticipation of that so it does not stain your underwear. Boric acid, as I mentioned, should not be ingested, so you'll always want to wash your hands thoroughly after you prepare the capsules, and it has been used for over 100 years with good results. There has been research on the boric acid, and it is a very well documented and known anti-virucidal, so it kills viruses, and antifungal, it kills fungi and yeast. It's been we call retrospective studies. It's been studied looking at a host of large groups of research studies that have used the boric acid in women with documented yeast infections and in placebos. And it's a little bit variable because everyone's different. The type of yeast they have is different. The amount that they have is different. But anywhere from 60 to 90% treatment rate for yeast infections versus placebo, which is a 3% with placebo, or sugar pills. So it does work very nicely against yeast infections. Now, it will require several nights in a row, so a minimum of 7, ideally 14 nights. I always recommend homeopathic regimens predominantly if you have recurrent issues. It's really good at preventative measures because we don't have prescriptions or medications that will prevent imbalances, only treat or address imbalances. So I hope that's been helpful information on boric acid and the vagina. This is Dr. McDaniel at GYN Corner. Please like and subscribe, follow here on the Facebook Live and on the YouTube channel. It's also GYN Corner, and check out the podcast. Please comment and give me ideas for any topics you're interested in hearing about or information you'd like to receive from me. I'm a board certified obstetrician gynecologist, and I've been practicing for 27 years. So have a great rest of your Thursday, and I'll be back tomorrow, Friday. Bye.